Hello everyone, welcome back to another video. I am getting ready for my first day of work as a dentist. Not a lot on my schedule yet. 5% of challenging time. Lasers, printers, scanners, milling machines. I have so much time. I put on black scrubs today. I can wear any colors that I'd like for this office, but I always go black on the first day. I think it's just simple. One less thing you have to think about. So I'm gonna put in a little bit of makeup and make breakfast. Okay guys, I'm just gonna brush my teeth and then we're gonna hit the road. It's about a 30-minute drive for me. I'm gonna be there like 10 minutes earlier than I need to, which I think is fair because I've gone to the office before. I didn't want to get there super early. Came home to some flowers from Justin. All right, I'm back from work and the gym. I figured day one I didn't want to do a 5 a.m. gym trip. That seemed a little ambitious, so I went to work, came back from work, had a quick snack and went to the gym just for like 30 minutes. It's the tiniest little garage shack thing since it's such a small town, but gets the job done and it's not too expensive. We're just making dinner now and then we'll probably go for a little walk and just watch some TV, very relaxed. I'll go ahead and do probably a recap of day 1, 2, and 3. That way I can better tell you kind of how I was going through the schedule. But pretty much just saw a lot of exams today and one operative patient, 4 extractions, like super easy extractions. And slowly we're gonna be adding in more patients and everything. Well, you got a little peek into my short and sweet morning routine. It's easier to film right now because Justin's already at work, so I could film a little bit more of what the morning looks like. After I have breakfast, I have about 20 minutes to eat that, so I can be on the road right at 7, and it takes me like 28 minutes to get to work. I like to get there around 7:30 at the moment, since I don't have a lot to prep for patients because there's not a lot on my schedule yet. I am gonna go to the gym right from work today. I'm gonna try that out and just pack some snacks in my bag and a change of clothes. That way I can be a little bit more efficient. I don't think that going to the gym before work at the moment makes sense, even though I loved working out before dental school patients. But for this like work hours and the way my gym is set up, I just don't think it would work very well because the gym is teeny tiny and doesn't have like a good bathroom getting ready area, and I don't really feel like wearing my gym clothes to work and changing. I totally could because we have good spaces there to get ready, but at the moment that doesn't really feel like the right vibe. So I'm planning to have a nice morning every day, go to work, bring a snack right from work, eat while I'm driving to the gym, work out, come home, make dinner, and then unwind will be kind of the routine, I think, at least for now. But let's head into work and I will talk to you all after. All right, day 2 is done. I'm at the gym right now. I'm gonna go in and change, do some upper body and cardio, and then go home at 6 o'clock right now. As you saw from today, I got a couple clips inside in hygiene rooms and then like a little, it's not the waiting room, but it's kind of an open area between the different operatories, usually where like kids will sit. If their parents are having work done, they can sit there if they don't want to be right in the operatory. I would say it's a very nice office, very updated equipment, and lots and lots of good technology, lasers, printers, scanners, milling machines, all the fun tools that you could think of. So I'm very lucky in that regard. A few of the operatories are more updated than others, but they're all definitely good enough for good quality dentistry for sure. But those were the couple clips I could get for you guys of what everything looked like. I really just did exams and I observed a surgical procedure all day that one of the associates was doing, which is what you see with this model, and then the printing machine was printing the implant retained denture. All right, we're back from work. I'm gonna heat up some soup, my tiny bit of leftovers from yesterday, which is actually what I'm about to cook. So I wanted to show you because it turned out so good. This air fryer salmon, I mean, it's just salmon, but I'll show you how I seasoned it because it turned out really good. So I wanna get a Costco membership eventually here, but we don't have one yet. So these are from Target. these salmon fillets. I feel like they are really good quality, like they taste good, but they are tiny, like, I don't know, skinny? I think it's the right size for a serving, but if you're feeding like a family, it only comes with 4 of these little guys. But for me, I think it's a good option and it's easy because I can kind of walk away from it. And I need to get better at like fresh things, but at least I'm making healthy choices. That's a good start to then going the full fresh route. I think frozen salmon is good and fresh. Also, Good and Gather brand. I love Target store brand salsa, their like little frozen appetizers, this kind of stuff. Their frozen veggies are really affordable and really good. So all those things, Target's a great place. And I like their store brand, it's affordable. And I'm gonna heat this up and put a portion of it with lunch for tomorrow, as well as also using a portion of that rice. But as I said, Target brand, that's where it's at. So this is essentially a frozen dinner prepped for lunch tomorrow. And we're gonna use this in the air fryer at 390 for 7 minutes. And then you take it out and I drizzle the hot honey on it. And then I season it with salt, pepper, onion, garlic, and paprika. And I just make sure to spread it out with a spoon so everything kind of evenly coats the salmon. Put it back in the air fryer for 7 more minutes, and it was super crispy, super good, not overcooked, not too dry. So we can call that your recipe of the vlog, a little air fryer salmon. And honestly, I am exhausted. Energy levels, I would say for a quick check-in, energy levels have been good throughout the day, considering I went from 2 months of doing nothing, unemployed, not in school. I was keeping myself busy, but it wasn't like a work schedule, was not 10-hour days, was not waking up early, obviously, so that's been a little bit of an adjustment, but not too bad, way better than I expected. So overall, energy levels good, mental state, nerves, anxiety, great, amazing, and that's all because I have such an awesome team. They're so encouraging, and they make me feel so welcome. They make me feel so comfortable to ask any questions that I have. I do have to push myself a bit when it comes to trying to be proactive and trying to gain as much experience as I can, trying to go throughout different operatories, watch different procedures, watch the owner doctor do exams and how he communicates with patients rather than just like sitting back and waiting for someone to come grab me to do something. I'm trying to be more proactive, or if I see something and I'm like, I wonder why they did that in the last visit 8 months ago, a year ago, like if they're doing a checkup today and everything's fine, but maybe they had a treatment plan previously that was completed. Why did you treatment plan this way? What did you think looking at this x-ray? What's your thoughts about this route versus that route? Like literally pulling up patients from today, but what they did in the past, or pulling up patients for next week. Oh, what do you think you're gonna do in this case? Literally just clicking through the schedule, clicking through x-rays, photos of patients, anything, and picking the owner doctor's brain and the other 2 associates' brains is really awesome. And I've learned a lot just from that in 2 days. So that's kind of where I have to push myself, is to be proactive and not be afraid to ask questions, because it's easy to be intimidated. You don't want to feel like you're in the way. And you also are asking them questions perhaps about work that they've done. So you might be worried that you're going to offend them or something, but it's all about how you go about asking it, of course, and not in a critiquing way, but in a, oh, I was curious what your thought process was for this case, or for a case coming up that maybe hasn't happened. Maybe you're embarrassed because you don't have 110% confidence that this is the route you want to recommend. Maybe you could see it going this way or that way, which is a lot of how we're taught to treatment plan in dental school, is, oh, here are your options, A, B, C. What would you like to do? That's very like overwhelming for patients, and that's why they're here and they're paying for your opinion and your educated decision-making skills. So at our office, we're encouraged to give a recommendation, explain our rationale, and say this is what, not even a recommendation. See, I'm getting caught up in the words. They're very big on verbiage at my office. So not even a recommendation, but tell them that this is what they need. And if they don't want to get it done, then we're not the office for them, essentially. So look, make a diagnosis, tell them this is the treatment that will get them healthy, and ask when they'd like to schedule it and go from there. That's kind of how they do things in a very holistic way, looking at overall health and trying to get patients healthy. They have a lot of, like I said, great technique, great verbiage, great communication skills, great systems in place from front to back office to in the operatory to with treatment coordinators, everything in between. It runs so smoothly, but there's a lot of all those little things that I'm still working on, and a lot of the communication and the verbiage and the way that we speak to patients, the way that we communicate treatment plans and everything of that sort. So those are all things I'm working on and things I'm trying to actively pick up on and ask questions about to the doctors whenever there's downtime. But again, it can be intimidating. It's something I'm working through, but I'm trying to just push through any of that nerves because I do really, really trust these doctors. I do feel very comfortable with them, and that's huge because some offices I was interviewing at, I think I would not have felt that way. So please make sure you keep that in mind when you go through your own process of looking where you want to work, because even though I trust them so much and I look up to them and I feel comfortable, you're still gonna have that little bit of, oh, I'm a little scared to ask this question for whatever the reason may be. But I just try to ignore it and I ask the question anyways, because I know that that's the only way I'm gonna grow and it's the only way I'm gonna learn. And it just wastes time to avoid it, and maybe it'll come up later and it'll be more of a problem. So it's better to just ask something as soon as it pops into your head. It sounds a lot more genuine and curious that way, rather than if you think about it all day and think, how am I gonna ask it? It's probably just gonna sound weird and calculated and probably come out worse than if you would have just asked it when it first popped up when you were looking at the photo or the radiograph or something. So those are my tips from the first couple days. We will get into your questions eventually. I guess this is a big cliffhanger vlog. You guys asked probably like 3 pages of questions. So if this vlog isn't too long, they will go at the end. At the bare minimum, I'll answer a few. And if I still have a lot left and this vlog is getting too long, I'll go ahead and do a whole Q&A about the first week or couple weeks of work. Maybe I'll wait till I've worked a couple weeks and answer them then. Let me know if you guys have any other content you want to see specifically with starting work. Obviously, it's gonna be show more of yourself at work, show your schedule, things like that. And I will be able to do that in spurts as I actually have more of a schedule to show, and obviously can only show so much throughout the day given with patients being around and everything. But I think I'll be able to find a good balance of like, here's what I'm doing, here's the setup, here's a lab work clip, something of the sort. I think it will all come together as time goes. But if there's anything specific that you want to see when it comes to dentist vlogs, please let me know. And with that, we will jump ahead to Wednesday because I'm gonna make dinner and relax. I think it is well deserved. As I said, even though it's been a great couple days, I am ready to decompress. It's 7 o'clock, I've been up since 6 and I've been going nonstop, so I'm ready to relax. And I will talk to you all tomorrow. Good morning, happy Thursday. I'm in my car about to head off to work. This is my last day of work for my first week as a dentist. I woke up around 6 this morning. I gradually was like adjusting the wake up time. The first day I did 6:20, then I did 6:15, and then Wednesday and today I did 6. I think I just like not feeling rushed. Bare minimum, maximizing sleep and everything, I could get up at literally like 6:50 and be out the door at 7:10. Change, quick face, teeth, breakfast to go, and then I have my 30-minute drive so I could eat in the car. However, I don't like doing that. I prefer to have more of like a morning where I'm not rushed and I can take my time, more like intentional with my breakfast, listen to something that I like, whether that's music or a podcast, just kind of spend some time doing things for me. Again, I don't think I'm gonna do a workout in the morning just based on how the gym is in this town. I told you guys it's so teeny tiny. They just switched locations, so as of now there's only like one bathroom. It doesn't have a shower or anything, like not really conducive to like work out and then get ready for work at this gym. I also wouldn't want to waste the time driving back and forth to go to the gym, come home, then go to work. So the only way I would work out in the morning is if I could go to the gym and then go to work directly, which maybe that will work as this gym's new location like keeps renovating and stuff. But it's about 7 o'clock. I'm gonna head to work in a minute here, but I wanted to answer a couple of those questions that you guys submitted, and then when we're back from work today, we will sit down and do a full recap because Thursday is a shorter day for me. I am done with patients around 1, and then at the end of every single day we do a quick just like 5 or 10 minute huddle for an end of day huddle, because we also do one at the beginning of the day. But sometimes on Thursdays they have an hour presentation until 2 o'clock. So sometimes you're treating patients till 2, sometimes you're in a meeting 1 to 2, and then you either huddle before or after that depending when patient care is done. But there is a meeting today about the office 401k offerings because they just switched to like a new platform. So some people have questions and I'm gonna see if I can get mine set up, which is Cool, yay, investments for retirement. Someone asked, can you interview the other doctors and see how they grew within the office? I like that question. That is not something I'm gonna do in this video, but I was talking to the other docs about it and I think that'd be really cool. So it might be here, it might be on the podcast. Maybe in a vlog I can do like a snippet like, hey doctor, tell me about what you're doing today. Tell me about how you learned X procedure, because like one of them does a lot of full mouth rehab, for example, and then one of them does a lot of sleep and airway and TMJ. So like, how did you learn about that and things of that nature. How many patients do you plan on seeing a day as a fresh grad out of school? Once I have a full schedule in 2 weeks from now, because we didn't know when my license would process, so it processed about like a week ago, week and a half ago I would say, and they usually are scheduling patients 2.5 weeks out if they see them for an exam and diagnose something. So meaning they couldn't put people on my schedule for this first week of work or really even the next week of work because they didn't know if I'd be licensed to do the dentistry. My schedule the next couple weeks is getting filled in as we go, so it's a lot of limited exams. I'm doing a lot of the periodic exams, which are during the hygiene appointments, and then usually there's like one appointment on my schedule per day of operative work, so it might be restorative, it might be extractions, and so that's what I've done past couple days this week. And then next week I think I have like 3 operative patients in one day. And then the following week, which is 2 weeks from when I started, is when they're trying to get me like a full single column of patients. So that's going to be a mix of fillings and crowns, and we're giving a pretty long amount of time for crowns. I think maybe almost like 2.5 hours, just because we also, and that's the full time, not doctor time, but we also mill the crown in house. So I think I have so much time to do these preps, but I figure let's block it longer for my first maybe 2-3 of them, and then we can condense it down. And I'm also looking at case by case what the tooth looks like when they're asking, well, how many time units do you want for this restoration? And for example, like it's a tween kid, like 10-12 years old, and they're little occlusals. Okay, I probably need like 5 minutes per tooth, so maybe we're blocking 30 minutes of doctor time just to be safe. Versus if it's like, oh, this tooth is bombed out, it might end up being a really complicated core buildup, might end up needing to involve endo. Okay, let's give a lot longer time for this crown appointment. So that's kind of how I'm analyzing things, and it's really great. The team's very supportive of anytime you want it adjusted, just come up and tell us so we can give the patient notice. So it's been really good. They're very happy to listen to me, and in my opinion, I'd rather have a little bit more time and then just finish early. As I start scheduling then the next set of that same type of procedure, I can cut it down and make my schedule more full, which would also be more productive, which is always good. That's definitely not the focus for now. Probably for the rest of the summer, the focus is just getting down the basics even more as my clinical skill set and communication skills, and then we can look at the numbers at that point. Like I said, I do have a daily guarantee for the first 3 months, so I'm trying not to be too worried about financials. I think they're just gonna follow because the office is wonderful at scheduling, and the treatment coordinators, which they call health advocates, are wonderful as well with helping patients work out financials to get the treatment that they need. So pretty much everything that we diagnose gets scheduled, which is lovely, and a lot of these patients have been really open to get on my schedule. Anything I'm diagnosing, pretty much, unless it's out of my skill set, is going on my schedule, and then even things that the other doctors are diagnosing, they're putting on my schedule as well if it's more simple, because we're just trying to like cherry pick easy cases for me to kind of get me used to the flow, the equipment, the materials, and not have the dentistry be too stressful is ideal. So that's kind of where we're at for scheduling. But in terms of like how will my schedule look as a new grad, as I said, once I get through the summer, I'm hoping I've ramped up to more of a normal pace. And what the plan is for me to run 2 columns, and there's also like an assistant driven column, and then there's anywhere from 3 to 4 hygienists each day, but there will still be another doctor there. I'm pretty sure the whole time that I'm there is the plan as of now for at least many months. I don't know if eventually they're going to switch up the schedule and have me be there by myself once I'm a little bit more independent, but for now there's always going to be another doctor in the office too, which is great. So we would kind of share the hygiene checks. It's not like it has to be this doctor. If it's a patient with no real concerns, anyone that's free is going to hop in. But if they're a good candidate for a smile makeover, they would go to the one associate, Dr. Bono. If they're a good candidate for sleep appliance or airway evaluation or myofunctional therapy, they might go to the owner doctor, Dr. Chad. So it just like depends. And if it's basic dentistry, they might throw it my way because they'd rather do the things they're interested in. But that's also how we're kind of looking at hygiene exams a little bit. So that's the first question. I gave you a very long answer, but I think that answers a lot of questions and kind of talk through a little bit how the scheduling works. But I'm going to head to work now so that I'm not too late. Okay, we've neared the end of this very long video, but I really did want to kind of recap day 1, 2, 3, and 4. So day 1 in the morning, I did 9 periodic exams, and lunch is 12 to 1 every single day. And then in the afternoon, I did 1 limited exam and then 2 extractions. So the difference between a periodic and a limited is a periodic is for an established patient that's on the schedule for their annual exam, like once a year that you would get at your hygiene visit, versus a limited, they're calling in more of like a problem-focused exam where they have some pain or something going on. So a lot of times those limiteds turn into treatment if we don't have a bunch of patients waiting in the schedule, which we'll get into other days of the week. The second day, which was Tuesday, I did an easy occlusal on 31. I did a few periodic exams and I observed a surgical procedure all day. I already showed you all that. And then in the afternoon, I did 5 periodic exams and 2 limiteds and continued to observe that surgery. And I actually stayed late that day. Usually we're done around 5:15-ish. We do an end of day huddle every day, so it varies. It kind of depends when everyone's finished. Then we huddle for about like 5 minutes just to say like what went well today, anything we need to know, any patients we need to do follow-up calls with, make sure everyone's on the same page before we proceed into the next day. That way nothing falls through the cracks and there's no like pent-up issues that don't get addressed. So that's why we do end of day huddle, and that's why the ending time can be anywhere from 5:15 to 5:30. That day I didn't really get out till 6 because the surgery was taking a little bit longer for the final dentures to print and deliver. So I wanted to see the whole process, and of course I'm there to learn, so I didn't want to bail out early at that point. Wednesday, I did an extraction on number 2. I wrote hard in all caps in my phone notes. It was just hard because of where the tooth had broken down. I had a difficult time getting a good grip with my forceps, but all of the extractions that I did this week were fine. I was able to do everything as simple extractions, didn't need to do surgical, and they might have been stressful in the moment, but looking back, I'm more proud, if anything, that I did it all. I haven't really had the experience where I'm like asking one of the other doctors to like bail me out. I'm really trying to go into situations that I know I can handle, and we'll go from there. They're obviously there if I need them, but we haven't really had that discussion yet, what that would look like, and hopefully we don't ever need to, and I can handle everything on my own as it comes my way. That's obviously the goal, considering that it's my license and it's my practice of dentistry now. Even though I'm seeing patients as an associate at this practice, it's still my procedure and my patient that I am in control of and responsible for. So that morning I did a limited that turned into a difficult extraction, but we got it done. And then I did 3 periodic exams and another limited that I adjusted occlusion and excess cement around a crown. So it was all in the morning. So a lot more like hands-on, I would say. And then in the afternoon, I did a limited for a brand new patient and ended up treatment planning for a crown. So I think that's gonna get on my schedule, which is great. And then I did 5 periodic exams. And one thing that's nice about all those periodic exams is also that I'm meeting a bunch of the established patients in the practice, which is so fun to get to know new people, and so they get more familiar with my face. If they do ever need treatment, then they would know me. And if I did treatment plan anything during those periodic, most of them went on my schedule. If it was just you need 1, 2, 3 fillings, you need a crown, whatever it may be, most of that got scheduled with me, unless when the patients went to check out, if they really specified like, no, I want the other doctor so-and-so because that's what I'm used to. Some of them did, but almost all of them were happy to schedule with me, which was very good as well, because I know that can be a problem at other offices. And day 4 was Thursday, which is a half day, sort of shortened day. We're done around 2 o'clock. 5 periodics that I did that day and 2 limiteds. And one of the limiteds, we tried to take a tooth out for a 7-year-old girl, and it was unsuccessful. We had nitrous. She was great through the anesthetic, didn't seem to be causing her too much issues, but once I tried to start the extraction, it was just not going well. She was wailing, and I ultimately decided that I wasn't going to be the best person for this job, so we ended up referring her to a dentist that specializes in kiddos. So that was the very last thing I did. My very first week of work was unsuccessfully have a case go, you know, having to stop and refer. So after 40 minutes of trying and taking her time and giving her breaks and doing some breathing together and calming down, but every time I went in with the forceps, freaked out. It wasn't loose at all because she's only 7. It's not gonna be loose for a few more years, but it needed to come out. It was too far gone to do stainless steel crowns, endo, anything of that nature. Like, so much of the structure was missing and decayed. But of course, like, that had to be the last patient. So that like little percentage of the whole week is like what I was thinking about driving home, and what really like sticks with you is like that one thing. And of course it's like a negative thing, but I recognize that and try to remind myself that 5% of 95% of good times should not be discredited by 5% of challenging times. And my owner doctor was so nice. He's like, great job, you did amazing. I'm like, I didn't do anything. We had to refer it. Like, I didn't get it out, you know? But he was like, I mean, even being willing to try is a big step, and being in there while she's screaming is a good experience, because over time we're gonna get kind of desensitized to that as a provider, and it won't make you as anxious internally. And the more confident that you are, the more confident the parent is, the more confident the patient is, and the more likely that it's gonna work, you know? So he was being so supportive and telling me how great I did, even though I didn't really feel like I did too great. So I'm very lucky to have such a wonderful team around me, and I had a really good first week. I'm gonna save some of your other questions, which include what's been like different with my new routine, what are some of the stresses, what are some of the best parts of working and not being in school, kind of how budgeting and everything is going. You can see I have a lot of new stuff that you haven't seen in my previous dental school apartment. Like, we got this dresser, we got our new king bed going, and then I'm turning 26 next month, so health insurance, and you have to pay for disability insurance as a dentist as well. So all these big bills, all these expenses, it's a lot, but we will talk about those questions as well as some of your other questions in upcoming videos. I'm gonna try to vlog at least like every other week of work and post a lot of videos for you all. So if there's anything you wanna see or any other questions you have, please send them my way on Instagram, and I'll try to answer them in future videos or maybe on Instagram stories or something. But thank you all so much for watching this video of my first week of work as a dentist, and I will see you in the next one.